And then the locals just laughed. They're like, no, you're not. You're going to do a 4-hour shift because you're not going to make it more than that. And turns out they were right. There's
Really?
no way. It's just so intense. It's the most intense traumatic experience I don't think any physician can understand. I would say take the most experienced trauma surgeon, in Baltimore, which is like one of the biggest trauma centers in America, and put him in Gaza, and it's like child's play compared to what's going on in Gaza. You're talking about like an influx of like 400 patients in like 4 hours with 30 casualties on arrival, 30 headshots on arrival, 30 critical mass shots on arrival, and then like everything in between, women, children, elderly, men, young boys. And it's just like, how the heck do you triage all this? And that was every day, man. So it took a mental toll.
What's that first moment that you noticed, like, oh my God, this is a lot?
Yeah, so the first day we got there was actually pretty chill, the Friday. But then the Saturday, they had the MCI. It's called a mass casualty incident. And they basically pull a fire alarm. I was like, what the hell is that? They're like, oh, every doctor come down to the ER to try to help. And so I was like, okay. So went downstairs, got in there. It's just like brain matter coming out of people. There's guts coming out of people's abdomens. There's people's legs blown off and someone's carrying it in next to the, one of the family members bringing it in for the doctors. And, they think you can just reattach it. And it's just like absolute chaos. There's family members, security in the hospitals trying to push out the family members so the doctors and nurses can take care of the patients. It's absolute chaos. And then us American physicians are just like looking at each other like, what is going on here? And, that's when reality hit. And I was like, okay, this must be like a one-off. And it just kept happening every day. And sometimes multiple times a day. And essentially, basically, we found the pattern related to when the GHF sites were opening up. Gaza Humanitarian Foundation is this American and Israeli initiative to bring in aid to Gaza, which basically has taken over all of the UN aid agencies, which the UN has been doing this for since World War II, right? Mm-hmm. And then I think in March, officially, Gaza Humanitarian Foundation is the only one allowed to bring aid into Gaza.
Yeah, we've been hearing a lot about this recently in the news, that there's like these long lines for aid, for food, right? You've been hearing a lot about like mass starvation and famine being used as a genocide tool. What do you see or notice with that, right? Like you're hearing that people are like, the food is set up and it's a trap. You're hearing that Hamas controls the food. You're hearing all of these things, but we know, like you said earlier, international journalists aren't allowed to cover this, right?
Unfortunately, yeah, that's right.
And so what did you see? What did you notice?
We were hearing testimony from everyone coming in